Welcome to this brief video on how to incorporate learners into clinical workflow. In this video, we will discuss adapting your schedule to accommodate learners, setting teacher and learner expectations, review techniques for maximizing students as value added, discuss tips for teaching during the workday, and review how to utilize other potential teachers in the clinical setting. Before your learner arrives, consider making some slight changes in your scheduling template as a technique to accommodate your learner. There are a variety of ways you can make changes to the template to improve your workflow. Double booking your first slot to allow you and the student to see patients in parallel is one way to help coordinate your time to allow students to participate. Also, periodically double booking appointments throughout the day and then having open appointment slots to catch up may be helpful. Feel free to experiment until you find a system that meets your needs. One of the greatest challenges when working with medical learners is finding ways to incorporate them into the day without negatively impacting your workflow. While there is not a right or wrong way to incorporate a learner, there are some general tips to minimize disruption. Of the techniques you can utilize to incorporate learners, taking the time to define expectations with your learner is likely one of the most critical. This involves thoughtfully examining your needs and those of your learner in the context of your clinical environment. Ideally, this is done at the beginning of the teacher-learner relationship. One approach to finding expectations is to think of the when, who, and how for your student learner. Some examples include: when and who should your students see? How long should they spend with the patients? When and who should your students present to you? How would you like the presentations to be given? The same basic questions can be asked for any component of what they do with you as a part of the team. Involving the student in this discussion will assure that they have a clear understanding of their role on the team. Be mindful that expectations will be unique for each learner based on their prior experience and will likely evolve over the time you work with them. Students have the potential to add value to your care team. Changes in CMS guidelines allow attending physicians to utilize medical student documentation as part of the official medical record. To make the most of the student's documentation, be sure to share note templates with the student and clarify what you want from their documentation. Providing examples of ideal documentation may help to clarify your expectations. Providing feedback to the learner about their work is also important. Other ways to incorporate learners include having them scribe for you as you take a history. You may also watch the student perform the HPI and scribe for them. Add any additional questions you may have, and then you can perform the exam together. Aside from standard clinical work, consider including your students with quality improvement initiatives or have them provide patient education or reach out to patients to follow up on lab results or additional information that may need to be communicated. At times, it can be challenging knowing when and what to teach learners during the hustle and bustle of a busy clinical workday. It is important to remember that these are adult learners, and a good portion of their learning should be through observation and experience. A few ways to easily incorporate teaching are to help your learner generate clinical questions, and then encourage them to investigate the answers and report back to you. Another approach is to simply take a moment to explain your thought process to your learner during or after a clinical encounter. An example would be describing why you didn't prescribe antibiotics to a patient with a viral upper respiratory infection. It is an unrealistic expectation for you to try to teach on every patient you see during a busy day. If your learner is inquisitive, consider encouraging them to write down their clinical questions, and then you can review them together at the end of the day. You can negotiate with the student which topics they should investigate on their own, and teach a few pearls as you see fit. An often underutilized resource is the other potential teachers available in the clinical learning environment. Consider placing students with front office staff, nurses, office managers, and referral staff for a few hours during the time they spend with you. To make the most of these experiences, take some time to clarify expectations for the staff members that will be working with the students. To prompt each of these potential teachers, you might ask, what would you want any young clinician to know about what you do in this important role? Students can also play a role in helping you keep up to date on your medical knowledge. It is appropriate to ask students to help you prepare for the next day's clinic by reviewing charts and determining gaps in health maintenance. Students can also review clinical topics and provide you with a brief presentation to help sharpen your clinical acumen. Be sure to give them feedback if they take the time to do this. Students can also help with patient education by creating or updating handouts, reviewing information with patients seen in the office, or by calling patients with follow-up information. Defining a great experience for a student is difficult, but in general, it consists of the student having the opportunity for meaningful involvement as part of the team, including interacting with and caring for patients. Ideally, if a student independently sees 3 to 5 patients per half day, they feel they are getting good exposure. Remember the core skills for medical learners and do your best to allow time to work on each of these during their rotation. If a student can dedicate time towards a few physical examination skills daily, oral presentations on 1 to 2 patients daily, and writing 2 to 3 notes daily, this would likely be a fulfilling educational experience. Thank you for taking the time to watch this video on incorporating learners into your clinical workflow. If you have any additional questions or would like additional support on this topic, please feel free to contact me.